I'm Megan. I will be on the affirmative side of physician-assisted suicide. So first I would like to bring up that my opponent said that physician-assisted suicide is inhumane. Technically, we have passive sorts of physician-assisted suicide already in an act. There's the do not resuscitate order, which is you can get it, it's a medical order written by a doctor that instructs healthcare providers not to do CPR if a patient's breathing stops or if the patient's heart stops beating. If you are near the end of your life or you have an illness that will not improve, you can choose whether you want CPR done. So again, this is more of a passive form of physician-assisted suicide. It's if you're already passing away, they're not there to help you. Also, there's also the voluntary stop eating and drinking order or act, where basically a patient who has already been diagnosed as terminally ill can actively decide they do not want to eat or drink anymore and let themselves pass away naturally. Voluntary stop eating and drinking is different from the natural loss of interest in food and drink that occurs when a person is actively dying. It's an informed decision to stop food and fluids while one is still physically capable in an effort to hasten death and escape suffering. This is according to the Hastings Center, which is a biomedical ethics group, and it's an independent, nonpartisan research facility. Also, when she says that it's inhumane, if you think about it, it says for voluntary stop eating and drinking, the decision is entirely within the patient's control, but it requires considerable resolve since the patient generally continues to live for 1 to 2 weeks after stopping. So can you imagine that, sitting there for 2 weeks, slowly starving and dehydrating yourself? To me, I feel that forcing somebody to do that rather than being able to take some pills to end it quickly is a lot more inhumane than, say, like I said, prescribing some pills where a person can pass away peacefully. Secondly, she mentions hospice workers and how that's an alternative. But the problem with that is hospice, resources at hospices are limited. According to, again, the Hastings Center, which is, they said that there are not enough skilled palliative care clinicians to meet the growing needs. So the baby boomers are obviously, they're all growing, they're all getting older. So that means there's a big chunk of the population that is getting older and is going to need that hospice care. But we don't have those resources anymore. It says the majority of patients who die in the United States are never transitioned to hospice, and mostly because of a requirement that once they are in the hospice, they will forego disease-directed therapy. So even once they're in these hospices, they've basically gotten the resolve that they are going to die. Because if they're dying of cancer, they can't receive any chemotherapy, they can't receive anything to treat their actual disease. They're just made to feel comfortable, or as comfortable as possible until they die. Also, hospices are very expensive because they are paid on a per diem basis, which is an average about $135 per day. And like we mentioned before, terminally ill patients are diagnosed, or their prognosis is 6 months to live. And if you think about that, 6 months, roughly 180 days, at $135 per day, that's $24,300 to spend just to let yourself slowly die. So again, physician-assisted suicide, or the Death with Dignity Act, it's to allow doctors to prescribe you medicine to end it quickly and at your own pace or whenever you so decide to choose. You're not required to do it right there on the spot. They prescribe you the pills and they are there for you when you're ready to pass. Also, my opponent mentioned a story of, I believe, Reeves it was, who was talking, I guess his wife said that she wanted him to live. Well, I have some statistics that actually show that the families of patients who've decided to pass with physician-assisted suicide, let's see, this is according to the Journal of Pain and Symptom Management. They took a survey and measured the mental health of the families of people who have either requested physician-assisted suicide or have passed by physician-assisted suicide. And 8 in dying family members overwhelmingly supported legalization of physician-assisted death. So 95 of them, this was all done in Oregon because that's where it was legalized. 95 out of 95, so 100% of them said that they would support the legalization of this act. And 93% of them even said they wanted this option for their loved one. And again, 93% of them even said they would consider the option for themselves. So if you're worried about your family or something like that, then obviously these statistics kind of show that it's actually supported by families. So, And again, she mentioned the progression of suicide and how legalizing it will only like carry it on and further the abuse of it. According to, again, the Hastings Center in a separate study of physician-assisted death, studies of the practice of physician-assisted suicide in the US suggest that the majority of jurisdictions where physician-assisted death is illegal, it accounts for approximately 1 to 2% of deaths. In contrast, physician-assisted suicide is less common in Oregon, accounting for approximately 1 in 1,000 deaths. So where it's illegal, it's accounting for 1 in 100 deaths, versus Oregon where it is legal, it's accounted for 1 in 1,000 deaths. Because the thing is, physician-assisted suicide, they prescribe you the pills and you are free to go whenever you so choose. And it'll be in a painless and more peaceful way, usually at home surrounded by loved ones. And it doesn't necessarily mean, like I said, it's your own choice, so that doesn't necessarily mean that it's going to be abused any more than anywhere else.